All right, well, thank you for Ari's interesting talk right before this, and thank you for having me. I'm also going to be talking a decent amount about the US retirement system, although I'll try to make the parallels to Canadian and other international systems as clear as possible. In particular, so this is research with Angela Hung, also at RAND Corporation, and it was sponsored by the US Department of Labor, but all of our statements and mistakes and all those are all our own and not attributable to them whatsoever. So just to start, kind of the motivating questions behind this line of research was trying to figure out, increasingly people have kind of retirement wealth coming from different sources, from whatever public pension systems as well as employer-provided pensions and whatever private savings they have as well. And the question is, when people are kind of thinking about how to start drawing down those sources of retirement wealth, are they kind of thinking of them all as a group, or are they kind of individually maximizing over each one separately? And in particular, are they kind of sequentially tapping into these resources, or are they kind of making a decision to start decumulating kind of everything at once and then moving on? And I think this is kind of the policy motivation for this, is that governments and firms set kind of ages and incentives in their pension systems. And if those have sort of spillover effects, if you change whatever the retirement age is, does that then change when people start making decisions on their own kind of private savings side, and to what extent that's happening? So a little bit of background. The kind of retirement portion of the Social Security system in the US is called old age insurance, and as Ari showed previously, right, it has quite a bit of income replacement for a decent chunk of the population, and in particular, as you can see, kind of the replacement goes up as people age, right? That is what it's designed for, to be insurance against kind of outliving your other savings and your other sources of income. The last major reforms to the Social Security system, though, were back in 1983. And for the purpose of this talk, kind of the most notable change was an increase in the full retirement age. And what this meant is that if you wanted to kind of claim at the same age, it's going to be a smaller benefit on a monthly level, or if you wanted to receive the same benefit, you have to wait basically a little bit later to get it. So it's sort of an across-the-board cut in the private discounted value of, or the present discounted value of Social Security benefits. And this was widely publicized. It's fairly clear that people were aware that the full retirement age was increasing. So I hesitate to say it was sort of a shock to wealth, because it's affecting people basically 20 years later. So they have kind of 20 years to change around their other finances to anticipate this, but kind of relative to cohorts that are just born 1 year earlier, 1 year later, they're going to be differentially affected. So that's on the Social Security side. As has been discussed already today, right, there's been this sort of shift increasingly away from defined benefit employer pension plans toward defined contribution plans, not just in the US, but many other industrialized nations. And in particular in the US, there are expansions of the individual retirement account, where I think the analog in the Canadian system is the registered retirement saving plans, the RRSPs. So I'll bring up IRAs from time to time, but that's sort of the Canadian analog. And what this means is that individuals, kind of compared to kind of generations previously, where you put 20 or 30 years in at a firm and you have your federal, your government retirement wealth and your employer-provided defined benefit plan, you really didn't have to make a lot of decisions. It was sort of whenever you chose to retire, that's your decision, right? Whereas now, how much you want to be putting into these particular plans, when you want to start drawing them down, and how to manage the assets when you're holding them, these are all kind of on you as the worker and potential retiree in a way that previously it wasn't so much. And as Social Security wealth itself is sort of being cut, as the full retirement age has been increased, right, the kind of younger cohorts need to depend more and more on this non-Social Security wealth, and are increasingly responsible for managing it, right? So that's a bit of the background. When thinking about how people can react to falling Social Security wealth, right? Now that their benefit, if they were to claim at 62, is going to be correspondingly lower, what are they going to do, right? Maybe they choose to wait a little bit longer, and in the meantime, start drawing down their other assets. They kind of pick the same retirement date, but then just choose to kind of make up the gap in the Social Security wealth by drawing on their other assets. Or if maybe not directly drawing down them, maybe they could just kind of slow the accumulation, just contributing less to their IRAs or defined contribution plans. Or, on the other hand, they could kind of be accumulating as much or more as lost Social Security benefits. So they could see this and then say, actually, now this means I will have to work longer or save even more because I know Social Security is not going to be around, and maybe start saving even earlier. And this is, I mean, to ruin the ending, this is pretty much what we find, that people are aware of this change in Social Security wealth, and they make up for it by saving more, in fact, exceeding the amount that they lost in sort of the Social Security benefits. But how do you compare these things all at the same time, right? If you wanted to look at the traditional survey-based measures to get the sense of what's going on with people's private pensions and private retirement savings, right? You'd want to know about their pension entitlements, about their retirement savings, their IRAs, and other forms of savings and wealth, and those are mostly gathered kind of in surveys traditionally, right? Whereas administrative records are very helpful for knowing kind of their history of earnings, which is used to calculate what is their Social Security wealth kind of going forward, and when they actually claim those benefits. So these are traditionally two different data sources, but in the US, we have the Health and Retirement Study, and there's a match to Social Security records. So it's a chance for us to kind of have eyes on both of these measures, both the private retirement wealth and the Social Security wealth at the same time. As Ari sort of discussed, I'm glad that he gave a little bit of an intro to here, is the big trade-off, the big decision in Social Security is when to claim benefits, right? And it's less money now versus waiting for larger payments later on, and this claiming age somewhere between 62 and 70. The optimal timing of claiming, right, depends on there are actuarial adjustments along the way. So for the average person, right, this shouldn't make a difference one way or another, right? The amount that kind of you're foregoing by not claiming is made up for kind of perfectly by the slightly higher benefit, but obviously almost nobody is average. So what's the optimal timing of claiming? Well, it depends on, do you think you're going to be dying earlier or later than average, your own work capacity and income, your marital status and spousal earnings, and mortality expectations all sort of factor into when's the best time for you to claim Social Security benefits. And there are some kind of components of it where survivors' benefits themselves can make claiming sort of later much better off. So it's not just sort of higher benefits for you while you're alive, it's even higher benefits for your widow or widower once you're dead. So what do people actually do? Historically, the vast majority of claimants kind of pick basically one of two ages, either age 62, so the earliest they can claim, or 65, or the full retirement age. And traditionally, 65 was the full retirement age. It's now up to 66. These age 62 claimants, the ones that have chosen to claim as early as possible, a lot of them, they're already retired, right? So they're drawing down their other sources of retirement wealth, and they would have probably liked to draw down Social Security as well, but they can't claim it earlier than 62. Once they hit 62, that's when they claim it. There's like a whole literature trying to convince people not to do this, because for the vast majority, for a good chunk of people, the majority of people, it's sort of better off to claim later, especially if they're married, especially if they're women who tend to live longer than men in the US. But people nevertheless tend to claim at 62. And again, as Ari mentioned, it's kind of less clear why there's a big spike at the full retirement age, because again, there's not a lot of things that are qualitatively changing right there. There's like slight changes in the actuarial formula. There are a couple other things going around, but I think a lot of the consensus in the literature is a decent chunk of this is just people see full retirement age, and that's sort of a norm, right? And they're like, that's the age that's sort of suggested to retire, so that's when I'm going to claim my benefits. The sort of variation that we're looking at here is before 2003, the full retirement age was 65, and then it was gradually increased sort of 2 months per birth cohort. So for people in 2004, it was 65 and 2 months, and then 65 and 4 months, up to age 66. It's going to rise again up to age 67 in a similar pattern between 2021 and 2027. Meanwhile, the early eligibility age, the earliest you can claim benefits, is fixed at 62. So given kind of the penalties for collecting benefits before the full retirement age, it means the full retirement age is even further away from age 62, so the penalty is that much higher. So you used to be able to get 80% of your full retirement age monthly benefit if you claimed at 62. Now it's 75%. So this sort of 5 percentage point drop. And again, it sort of represents a general cut in present discounted value of benefits. The kind of past research on this has shown that the majority, about kind of 2/3 to 3/4 of people affected by the rising retirement age, are just kind of changing their claiming age in lockstep with the new one. So claiming at 65 in 2 months and 65 in 4 months and so on. So people seem to be responding to this. And also kind of pushing back their retirement dates as well. So not just when they claim benefits, but when they choose to exit the labor force. It's a little unusual because the people who seem to be most reactive are the ones who kind of had previously the highest earnings, the ones who actually are going to be depending on Social Security the least and probably shouldn't be having Social Security policy be affecting their own retirement decisions that strongly. So that's a bit of a puzzle in the literature. The data set we use, as I mentioned before, is the Health and Retirement Study. So this is a nationally representative survey of households with at least one member age 51 or over. It's a panel survey, and it began in '92, and every 2 years, these individuals are re-interviewed, and then new cohorts are added over time in order to keep it nationally representative of 51 and over. I'm going to focus on the cohorts that came in '92, '98, and 2004. Not too important for you to know the exact birth years here, but just to know that it covers people who were kind of their full retirement age is 65, and it covers that intermediate group that now it's rising, and also the people for whom it's 66. So kind of across the entire source of variation. And it includes detailed kind of self-reported data on household wealth and income, and retirement wealth and income, and then all these pension accumulation decisions as well, when people start withdrawing from their defined contribution plans or IRAs, or when if they cash out or start taking their defined benefit plan entitlements as well. There's a match between the self-reported data and Social Security records. For our sample that we're using, it's about a 75% match rate. There's been some previous research, actually by Ari and others, trying to look at, do these people systematically differ if they're willing to have a match to Social Security records versus not. It's already like a very extensive, kind of a fairly invasive set of questions. If you're willing to answer all of these every 2 years as it is, you tend to be okay with people knowing more about you for research purposes. So you don't actually see a big kind of bias across the observable characteristics. And then the Social Security data, it includes kind of claiming dates, so when people actually chose to claim, and benefit amounts, how much they were receiving, and the lifetime Social Security covered earnings up until that point. So it's very rich data, administrative data. What we do is we use these data to categorize people into kind of 3 claiming groups. The people who claim right at age 62, people who claim between 62 and the full retirement age, and people who claim at the full retirement age or later. Almost nobody claims after the full retirement age, even though your benefits would continue to go up. It's pretty much once you're at full retirement age, that's the last sort of big spike. Also, it's worth noting a lot of previous research, this kind of intermediate group, the 62 to full retirement age people, like kind of who are exclusive, it's one that's sort of harder to capture with survey data, but because we have administrative data, we can kind of separately isolate them, and they look kind of much different than the other 2 groups. It seems that they actually were expecting to claim at the full retirement age, and there was some sort of shock that occurred, either kind of a health condition, losing health insurance, something like that kind of pushed them to start claiming Social Security benefits earlier. So separating those out using these administrative data actually kind of provided a little more insight about the heterogeneity of these groups. As you'd expect, kind of you look at the percent working by claimant type across 3 ages, those 60-61, 65 or 66, and 70-71. So the blue line is at 60 or 61 before anybody's ever claimed benefits yet, right? And you can see that already, right, among those people who will claim at 62, fewer than half of them are working, right? So they're already, like the majority of them are already out of the labor force before they've even claimed benefits, right? So this is part of the story of, a good chunk of those early claimants are just already retired, right? And then you can see the work rates are much higher among the later claimants, but then eventually as you get to age 70 or 71, pretty much everybody is retired. So we also have these measures of what people are doing with their private pensions, right, with their non-Social Security retirement wealth. And the questions are, have you ever withdrawn from your individual retirement account? Have you ever cashed out or annuitized pension wealth, right? So these are sort of metrics of, are you starting to draw into that money? Are you taking active decisions around that? And we also have the kind of stocks, the holdings. So what are the balances of your defined contribution plans, your individual retirement accounts? Also, we have these sort of prorated, present discounted defined benefit entitlements as well. There's a methodology that Alan Gussman and co-authors put together to allow kind of easy calculation of that. And then we also have measures of present discounted retirement benefits through the Social Security system, the old age insurance benefits. And just as an example, you can see, what's the fraction of people who, conditional on having an individual retirement account, have started withdrawing money out from it at different ages. And once again, you see the early claimants, the age 62 claimants, are more likely kind of at every particular age to have already been starting to draw down their other sources of retirement wealth, right? So this is, again, consistent with a good chunk of those people already being retired. And then as people are aging, they're just kind of more and more likely to be pulling money out. Just to give you a sense of the relative magnitudes of that, there are a lot of numbers on this page in case you're trying to look for any particular incidents or amounts, but the bottom two rows compare, across these measures, defined contribution, defined benefit, and IRAs, what's kind of the total household holdings on those sides, and how does it compare to the household Social Security wealth in our sample. And what we can see is that, just for the means, there tends to be, traditionally in these kind of earlier cohorts, a bit more savings on the non-Social Security retirement wealth. But they're relatively similar in terms of magnitude, and the most recent cohort affected by the Great Recession saw kind of much greater falls in the non-Social Security retirement wealth, especially given the kind of defined contribution holdings, and if they had those in the stock market, for example, that accounts for a decent drop. But that's just a sense of the relative magnitudes of these. But what's nice about having access to all these household level data is that we don't have to do these measures just at the means. We can break them apart. And so what we do is we focus on basically splitting these non-Social Security retirement wealth, that distribution, into quartiles. So first off, we can look at maybe the top non-Social Security retirement wealth quartile. So these are the people, the top quarter who have the most savings in defined contribution plans or DB entitlements or IRAs. And what we do is we track them over time. So starting at age 56, we limit it to people who haven't claimed any Social Security benefits yet, and sort of see at each particular age, what's happening to them. Well, now there's a bit of a formatting thing, but this orange line is people who enter Social Security through the disability component of Social Security, right? So that you can be eligible at potentially any age, provided you have a recent work history and paid into it. And so these are people who can get access to these benefits even before age 62, but are they drop out of the labor force and on average are much sicker because they're disabled. The different bars above that are different measures of kind of mortality overall. The big purple one is people who are entering Social Security through the retirement component, right? So as you can see, these benefits aren't available until age 62, and then there's a huge, that's when a lot of people are claiming these benefits, right? And continuing through 64 and 66, and by kind of age 70, that's really the big mass of people in the top quartile of retirement savings, of other forms of retirement savings. And then this blue line, if they're alive and they haven't claimed any Social Security benefits yet, right? So, these are people who have they're the wealthiest among the group. Most of them were working initially. By age 70, most of them are still alive and receiving Social Security retirement benefits, right? So that's the kind of transition. This graph looks the same if you go to the second highest quartile, a little more disabled people, a little higher mortality, but not a huge amount. You go down even further. It should be the third one. Oh yeah, the second one. A little bit, even more potentially disabled and mortality, but not that much. But the picture kind of changes dramatically once you go to the bottom quartile here, right? So these are people who actually have zero in terms of other retirement wealth savings. And when you compare them kind of across, what you can see, there's a lot more people getting on the disability system, right? So claiming benefits as early as possible because they're in poor health, right? There's a much higher mortality rate among this group. But then interestingly, there's kind of a much greater number if you look at the alive and working, the dark blue one on the bottom. There's a much greater number of people who are alive and still working at age 70 as well, right? So these are people they have no other retirement savings, and either they're kind of potentially for health reasons claiming as early as possible, right? Or because they don't have any retirement savings, kind of trying to stay in the labor force for as long as possible, right? On the other side of things, right? So it's a very heterogeneous group that seems to be probably under a decent number of constraints, right? So that's kind of just the descriptive component of it, right? Which is that a lot of the earliest claimants seem to have already started drawing on their non-Social Security retirement assets at age 60 or by age 60. I didn't kind of show you this, right? But those people who are claiming in between, the ones who, they seem to be claiming earlier than expected and are doing so because of these shocks. But that lowest non-Social Security retirement quartile, the people who really have zero in other forms of retirement savings, right, have higher mortality, higher rates of disability, but also higher labor force participation at age 70, right? Which is a bit confusing. They're kind of on both extremes. So that's the descriptive component. The analysis, the more causal-based one, is trying to look at, this rising full retirement age means that there's this sort of change in your Social Security retirement wealth, and how do the cohorts facing this respond in terms of what they're doing with their other forms of retirement wealth. This is just a cumulative distribution function of claiming retirement benefits, and you can see for these cohorts that are facing these full retirement ages that are just a little bit 2 months earlier, the last sort of peak is, moving basically 2 months at a time further and further away, just showing that that last sort of incidence of claiming is happening, initially at 65 and 2 months, 65 and 4 months, so on and so forth. But there's also a lot of stuff happening kind of before that as well, right? Because although these are adjacent birth cohorts, they're facing kind of slightly different economic environments as they're approaching retirement. So we want to control for all of that, right? So here's a lot of text here. The way that we do it is basically by doing kind of a point-wise estimation of these CDFs across a number of measures. So that one would have been of just claiming retirement benefits, but we also look at, have you ever started accumulating non-Social Security retirement wealth? And then what are your Social Security retirement, non-Social Security retirement asset levels? And we control, so we look specifically just among men in this particular paper. We're looking to expand it, but we control for age and year effects and a bunch of covariates for all of these kind of individual and household characteristics and what would be going on in the economic environment. And we can do this for each cohort, going through this, and kind of have these measures of trends across these cohorts. So we can get, what does it look like, the secular trend in each of these variables is, what does that look like? And then how does that change once you go from everybody has age 65 full retirement age to now the full retirement age is getting kind of higher and higher and higher. And that trend break, that's what we're attributing to the rise in the full retirement age, right? So this is, so the Giovanni Mastrobuoni paper from 2009, I think he argues fairly well that this is the way to identify the effect of the full retirement age on your outcome of interest, because if you try to look at what's happening with actual changes in benefits once people claim, it's confounded by behavioral effects when people are trying to kind of adjust their behavior to the full retirement age. What are our findings? We kind of reproduce what's found in the literature previously, that people are delaying Social Security claiming, right, kind of fairly in lockstep. And people are also delaying retirement decisions. Not quite as cleanly, but still, like, we actually get very close to the previous estimate, so that was reassuring, that using our data, we were able to duplicate previous findings. But what using our data that previous papers couldn't look at is what are people doing with their non-Social Security retirement wealth. And what we find that people are also pushing back to accumulating. So they're less likely to be withdrawing from their IRA or to be cashing out, to start withdrawing from their defined contribution plan or to start receiving defined benefit payments, pension income. And in particular, the retirement wealth levels, the non-Social Security retirement wealth levels are systematically higher for these later cohorts. But I mean, the nice part about our data as well is we can look across the whole distribution. We find really no behavioral shifts in any way for that bottom retirement quartile of wealth. So the people who otherwise seem to be fairly constrained, right? Like their disabled or have higher mortality or are trying to work for as long as possible because they don't have any other kind of buffer, right? These are people who just are going to be most reliant on Social Security, but aren't actually that responsive because they're probably constrained one way or another. But if you look kind of in general, you can do this for the back of the envelope calculation, where for every dollar lost in Social Security wealth from the rising full retirement age, all of this sort of delaying in decumulating pensions, all this kind of stuff, is actually leading to kind of more than offsetting that amount. So for every dollar lost, there's $3 gained in these non-Social Security, like tax-preferred retirement vehicles, right? And part of that is mechanical, because people are working a little longer, but depending, like you can try different sets of assumptions over savings rates and contributions. At most, the mechanical effect doesn't even explain half of that, right? So it seems like people are aware of this big change in Social Security, and they're changing the way that they're planning for retirement in a way that kind of more than offsets it one way or another. So this policy change on the public pension side really did have these real consequences on the private retirement savings front. So that's pretty much like what I've got. So just to go over kind of what we found, right, is that we're able to measure decisions and holdings across both Social Security and private retirement at the same time. We found these kind of interesting, it's important to look distributionally what's happening because those who really don't have non-Social Security retirement wealth had higher mortality, were more likely to be disabled and take early, but also more likely to kind of work as long as possible. And we found that kind of the 3/4 of the distribution really are reacting by delaying claiming benefits, delaying retirement, and continuing to accumulate outside forms of retirement wealth. And it kind of more than offsets the fall in Social Security wealth. But those most dependent, those without other forms of savings, can't really react to this change in the full retirement age. And moving forward, for this particular study, we're looking at basically just tax-preferred ways of saving, but that's, as is brought up, things like home equity, things like that. That's something that we can also include in the analysis going forward. And we also want to look at get a little more finely tuned in what decumulation measures we're looking for. And ultimately, do we see differences in kind of adequacy of retirement savings across these cohorts, since these people have saved kind of more than previous cohorts and have higher wealth? So that's where I'll end it, and I'm happy to take questions now.